Statistics at the National AIDS Control Program NACP show that 69,000 people living with HIV/AIDS are on anti-retroviral medication. Global Fund, the biggest donor for HIV/AIDS activities in the country, is funding the treatment of 49,000 people living with HIV/AIDS, and the health sector is catering for the remaining 20,000. The program's manager of the National AIDS Control Program, Dr. Nii Akwei Addo, says local funding to cater for the remainder must be found since government alone cannot shoulder the burden. Dr. Nii Akwei Addo made this recommendation when the National AIDS Control Program appeared before the Public Accounts Committee in Accra.
The Public Accounts Committee today heard evidence of the Auditor General's report on the management of claims and distribution of anti-retroviral drugs in the country. Those who appeared before the committee included the Ghana AIDS Commission, National AIDS Control Program, Ghana Health Service, Central Medical Stores, and Danadam's Pharmaceutical Industries Limited. When the program manager of the National AIDS Control Program, Dr. Nii Akwei Addo, appeared before the committee, he briefed members on why it had become necessary to source for additional funds to treat people living with HIV/AIDS.
Unfortunately, in 2011, the Global Fund cancelled the process of submitting proposals through rounds-based approach. They have dropped what we did in this country, which was also unique and helped us get a lot of people who were infected to come and know their status. General population testing, know your status. They've dropped that out. They don't support, so we have to look for resources to do that.
Members of the committee were not happy that monies paid as treatment fees per visit of people living with HIV/AIDS to health facilities had found their way into the personal accounts of some care providers.
When we started the program, we were asked to collect 5 cedis each from every client who comes to the facility to access health care. So we were keeping the money, and there was no directive that paid this money into this account. When I was leaving for school, I said, I told my colleague, this is the money, what do we do? And he said they cannot keep it. And I said, if that is the cater, to put it here to get lost, let me keep it. Anytime they give the directive, then we'll pay.
The Chief Executive Officer of Danadam's Pharmaceutical Industries Limited, Dr. Yawe Dujemfi, was asked why his company had not received World Health Organization certification to manufacture antiretroviral drugs for Global Fund programs in the country.
What we call that we don't have in West Africa or Africa is a lab called Clinical Bioequivalence Center. And that is where the medicine that you are making are given to patients. They draw their blood and see the amount of the drug in the blood. That is the only thing that we have not done.
The National Health Insurance Authority, NHIA, was the last to appear before the committee. Members wanted to know what progress the NHIA had made in the pursuit of cases in which some care providers had been charged with misappropriation.
There have been cases where we have done prosecution of people who have been found to be complicit in some of these clinical audit findings.
Other public boards and corporations will appear before the committee tomorrow.